Welcome, everybody. On behalf of the North American SCI Consortium, I want to thank all of you for joining us today for this great opportunity to hear about one of our new and most valued partners, Restorative Therapies. Today, we're going to let them make a presentation talking about their products, the Advanced Integrated Functional Electrical Stimulation, FES as we all know it, with Restorative Therapies, and they'll focus on their RT300 and Excite 2 products, where they optimize health outcomes and preventing secondary complications after neurologic injury. We'll hear from experts in the field, representatives from Restorative Therapies, as well as a person with lived experience who can tell us firsthand on their experience with the product. Before we start, I just wanted to let everybody know that this is part of a general program that we offer our partners on behalf of the North American SCI Consortium. We are your host organization, and we wanted to let you know a little bit about who we are. Our membership includes 63 community-led organizations, over 375 individuals with lived experience, and 159 partner organizations. And of course, we are here as a product to really is our mission to bring about unified achievements in research, care, cure, and policy by supporting collaborative efforts across the spinal cord injury. If you can go to the next slide, please, Laura. So really a little bit about Restorative Therapies. I'll speak a little bit today, and then we'll have our friends from Restorative Therapies give their presentation. I'll ask that those of you who have questions with regards to whatever they're talking about today and their product, please feel free to, we'll field those questions at the end of the presentation, but by all means, put them in the chat room as you see fit throughout the presentation, and we will try to get back to you as soon as we can and throughout this presentation and address them that way. So about Restorative Therapies, they're global leaders in integrated FES technology. As you can see, they've got over 20 years of innovative restorative therapies, and they deliver advanced neurorehabilitation solutions that help individuals with neurological conditions achieve their full recovery potential, both in the clinic and at home. They were founded in 2004 in collaboration with both researchers, engineers, and patient advocates. They pioneered the development of advanced rehab technologies, and they set the standard of care for neuro rehabilitation worldwide. Their mission is to empower people with neurological impairments or critical illnesses to reach the highest level of recovery and independence. Their impact, they're trusted in over 30 countries. They're supported by 40 plus years of peer-reviewed research, and they are approved FDA-cleared Class 2 medical devices, improving muscle health, circulation, and functional recovery. I just want to add, I myself, as a person with lived experience who had an injury in 1987, have had the opportunity to use this product, at least one of the products, in a clinical setting, and had some treatment for a while, and I thought it was fantastic. I really enjoyed the opportunity I had with Restorative Therapies, and I really urge you to listen closely today and hear about their product, and frankly, feel free to ask them the questions that you might be able to help you go forward if you're thinking about getting involved with the product itself. So if we go to the next slide, I just want to introduce our two guest speakers today. We have Lori Megerfleisch from, she's a senior clinical educator from Restorative Therapies, and Colleen Connaughton, a clinical educator as well. Both are physiotherapists, and we look forward to hearing from them and their presentation. And like I said, we'll also hear from a person with lived experience. Ladies, take it away.
Thank you, Barry, for that nice introduction. We are really excited to be here today to kind of talk about our products and how it can benefit your patients and patients with neurologic injuries in terms of their health and recovery. All right, so just a brief agenda, a really quick introduction, a reminder about how FES works, who can use it, who shouldn't use it, indications, contraindications, our benefits, and then we'll talk a little bit more about activity-based therapy and how mass practice and task-specific training, both integrated with FES, fit into that paradigm of rehab, how we might develop a plan of care, translate that into home use or some use for outside the clinic for long-term benefits. And then we have a special guest with us today to give a testimonial, kind of talked about his lived experience with the products. All right, so first our why. Like, why are we talking about this? Why do we use FES integrated products? So we know that inactivity has a really profound impact on the health of all of us, whether we're able-bodied or have a neurologic or some other type of injury. The patients that we treat as neurotherapists tend to lead a very sedentary lifestyle, and they are prone to develop secondary complications and comorbidities. And, like respiratory issues, cardiovascular issues, whether it's metabolic, developing diabetes, muscle atrophy, pressure injuries, all these things then impact their quality of life, decrease participation in the home and community. So now our challenge as clinicians is to figure out how to provide these individuals with the same level of activity that we as able-bodied people are able to get much more easily. And this is where FES can have a huge impact with them. So quick overview of FES. So if we look, I hope you can see my cursor on your screen. Not sure if you can, but if we look at this image, it's kind of showing how the FES is working. You can see that two white rectangles representing the electrodes on the quadriceps muscle here, and this little lightning bolt is representing where we're applying the electrical stimulation. So we're applying it at the most distal portion of the lower motor neuron, so in the peripheral nervous system near the end plates. This will cause an action potential, which will release neurotransmitter and that whole cascade of events to cause an involuntary muscle contraction. Right, so the stimulation is going to flow back and forth between those electrodes to cause that muscle activity. At the same time, we have antidromic propagation back up to the central nervous system. All that sensory information is going back. So we're really kind of exciting the whole pathway here when we're using FES. To give a visual of this, right, we can see again, we have those electrodes. The yellow is representing the stimulation. We can see as the stimulation is applied, we get that muscle contraction. Now, if we do this repeatedly and in a pattern, we can perform functional movements. Okay, right. And we're going to keep in mind that with paralyzed muscles, FES is the only way that we can activate these muscles to get any movement or activity there. So who can use FES? So anyone with an upper motor neuron injury. So disorder, disease resulting to some lesion in the central nervous system. So we most often see patients with spinal cord injuries, traumatic brain injuries, MS, cerebral palsy, stroke, but really we're not limited just to those diagnoses, right? There's lots of other upper motor neuron injuries out there. Since we're activating the most distal portion of the lower motor neuron, those peripheral nerves have to be intact in order to evoke that muscle response from the FES. But we can apply that FES to lower level or higher level or higher functioning individuals. It doesn't matter. There's so many benefits from FES that depending on the goal of your treatment, most people are good candidates. Okay, so we're looking at our FDA cleared benefits of FES evoked activity. So again, these are our indications. So reducing muscle atrophy, improving local circulation now because we're getting that muscle activity, increasing, maintaining range of motion, working on decreasing spasticity and neuromuscular re-education, right? These are just a few benefits. This is what we're cleared for, but there's lots and lots of other benefits in the literature that we're going to talk about today as well. Looking at contraindications and precautions, there's not a lot of people that can't use FES. So absolute contraindication from the FDA is cardiac demand pacemaker. We know lots of patients that have pacemakers that are able to do FES because they've been cleared by their cardiologist to do so. So always worth having that conversation because the benefits may far outweigh the risk of this, but having that conversation is really important. Other contraindications include pregnancy, which is only temporary, unhealed fractures in the area we want to stimulate. So if I have a leg fracture, I can still do FES in my upper extremities. And then for upper extremity cycling, we say grade 3 or greater rotator cuff tears, really because we just can't stabilize the shoulder well enough with those larger rotator cuff tears to make it safe for that repetitive movement. A few precautions that we'll talk about include implanted devices like baclofen pumps and diaphragmatic pacers that we see all the time in our patients. We can work around these in most cases. So we'll just change our electrode placement so we're not directly over those devices. We don't communicate with those devices with the FES, and it's generally not an issue at all. We don't put electrodes over compromised skin, and then range of motion limitations that can't be accommodated for in our physical setup for specifically with FES cycling. Although in the devices that Restorative Therapies makes, there is so much adjustability that I can only think of maybe 1 or 2 people in my career that I couldn't get set up safely. So also evidence-based interventions. Barry mentioned this when he introduced the company. So there's over 40 years of research, probably closer to 50 years at this point, into FES, especially in the neuro population, with thousands of peer-reviewed studies published in journals showing the benefits of FES. So whether we look at mass practice with ergometry, so not only are FDA cleared benefits, but things like preventing pressure injuries, improving metabolic function, cardiovascular function, gait, bone density, quality of life, all really important benefits. And even with task-specific training, more functional type movements, improving use of both the upper and lower extremities in terms of like self-care capability, motor control, and strength. So we'll talk a little bit about activity-based therapy. I hope that this is a term that you're all familiar with. But restorative therapies devices are all based on a model of rehab called activity-based therapy, which maximizes the central nervous system's capacity for plasticity. So it's this neuro-restorative approach using intensive practice to improve function and regain motor skills. So we're aiming to restore function by activating the neuromuscular system below the level of injury, rather than just looking at compensatory strategies. It's not that those compensatory strategies aren't really important in terms of our rehab, but they're not the only thing that we should be focusing on, right? We can actually see repair of the nervous system, things like new cell birth, synaptogenesis, remyelinization, using this ABT approach, right? So it's a high volume, high intensity approach, right? There's 5 main components to this approach. You can see them on the screen representing the key here. So functional electrical stimulation, task-specific training, so those functional movements really aimed at the specific goals the patient has. So task-specific practice, mass practice, so lots and lots of repetitions, locomotor training, and weight bearing. Right, so all of those things together kind of create this key to unlocking the nervous system's capacity for neuroplasticity. Okay, the more of those 5 key tenets that we get into an intervention, the better it is. Right, so we'll start then by combining mass practice with FES. Okay, so we're going to integrate the FES with an ergometer or a motor, right, to perform that cycling motion, to deliver pattern stimulation at a high intensity. Okay, so again, if we look at in the video, you can see when those electrodes kind of turn yellow, it's when we're applying the stimulation. So now we've integrated the stimulation with the motor such that it's timed in coordination with the movement of the pedals or the crank. So as we're activating quadriceps, the leg is pushing out. into extension. We activate hamstrings to pull back. Okay. If we think about it, every time the crank rotates, I don't know why it stopped playing, we're getting one muscle contraction in every muscle that we have electrodes on. So in 10 minutes, if we're going 30 RPMs, that's 300 repetitions, which is a level of activity that we can't, as therapists, do manually. I don't know how else we can get 300 muscle contractions in 10 minutes from anybody. Okay, so looking at some additional benefits of FES ergometry, we talked about kind of those main ones a little bit earlier, which included spasticity management. So we have lots and lots of patients with spasticity. So roughly 78% of people with spinal cord injuries at a year post-discharge have spasticity, and about half of them require pharmacologic treatment. Right? That's a lot of people, and spasticity really kind of affects their overall quality of life, functional movements, getting daily care from a caregiver, things like that. So FES cycling has a positive impact on spasticity immediately following an FES session. It's really important to think about this. If you're moving from FES cycling into a functional task, reducing that spasticity first can have a really positive impact on that patient's ability to perform that task, whether it's a smoother smoother movement or a better range of motion, things like that. We can also see sustained effects of reducing spasticity with higher volume, more consistent cycling. So 6 months after a 6-month follow-up for a study that included 45 to 60 minutes of FES cycling 3 times a week for 4 months. They saw these sustained effects, which is really, really nice. So that's a more long-term effect for our patients. And we also know that it can not only improve spasticity, but then walking ability and lower limb strength in those individuals as well. Looking at pressure injuries. So we know that this is also a high incidence in our SCI patients. So the incidence ranges from 20 to 31% annually, resulting in quadrupling of costs in our healthcare utilization, right, compared to those without pressure injuries, which is really a huge impact. It's estimated that 1 to 3 million pressure injuries occur every year. Right. And then those injuries can lead to other comorbidities like infection, increased spasticity, increased autonomic dysreflexia. Right. So this is a huge burden on our healthcare system and a big quality of life issue for our patients. Right. No one wants to be on bed rest because they've developed a pressure injury. So there's moderate evidence for both short and long-term benefits with FES cycling on factors that can help prevent pressure injuries, like pressure on our ischial tuberosities, muscle volume, and tissue oxygenation. Right? These things are really important factors in helping to keep that skin intact. In terms of muscle and bone health, right? So if we look at muscle health first, a review in 2023 showed that FES cycling demonstrated improvements in lower limb and trunk muscle cross-sectional area, as well as lean body mass and thigh circumference, right? So we can hypertrophy muscle. So not just reducing atrophy, but actually hypertrophy muscle over time. We can also see an increase in bone mineral density, or at a minimum, delay the loss of bone mineral intensity with FES cycling, again, especially with early use and then longer duration, high intensity protocols. All right, so if you see a theme here, it's that we need more consistent cycling to see these prolonged health benefits. So another study review that came out recently supports that moderate to high evidence of effectiveness of FES cycling in improving muscle health, in particular in this case, with 30 minutes 3 times a week for 4 or more months, right? This is with anything, right? If I go to the gym once a month, I'm not going to see as good an impact if I went 3 times a week, right? So the same thing applies here with FES cycling. And just to demonstrate that a little bit further, can you see my cursor on the screen? Okay, cool. So on the y-axis here is percentage improvement in energy expenditure. So for those patients that we can get really strong muscle contractions, condition their muscles over time, they can push the pedals with just FES, evoking those contractions in their leg muscles or arm muscles without a motor helping them. So performing progressive resistant exercise, meaning they can push power and expend energy. So on the left, again, percentage improvement in energy expenditure. The x-axis is number of sessions per week. So from 1 to 5 or more sessions per week. Each individual colored line represents a length of time. So if you're sitting here thinking, wow, she just said my patients need to FES cycle like a lot to have these impacts, but I only get to see them once a week in clinic or 3 times a week in clinic for a few weeks, you can still have an impact on their health with FES cycling. This blue line represents 13 weeks, which might be, a typical kind of bout in outpatient therapy. At 1 session per week, there's still a 50% improvement in their energy expenditure over that 13-week period. So they can still benefit from using that FES bike in clinic, even if it's only once a week. If they now have access to that FES bike on a more consistent basis, whether that's at home or in a wellness type center, they get even bigger impact, right? Just like, again, I go to the gym once a month or I go to the gym 3 times a week. So the red line is 26 weeks, 39 weeks, and 52 weeks. So the purple line is our year long, and you can see like the incredible increase in energy expenditure after just 1 year with consistent cycling throughout the week. Okay. This is Brian. You're going to meet Brian in just a little bit. We call him our poster child. Sorry, Brian. He loves FES. But Brian was injured 17 years ago. So in 2008, he was injured, and he was very fortunate to be exposed to FES very early on in his rehab stay. His very first FES bike session was in 2008. And you can see a little bit of energy expenditure, right? A little bit of power generated. We can calculate MET minutes. I'm sorry, let me back up. Brian has a C4-5 Asia A injury. This is really important to note when I talk about his results. So this is fully FES evoked FES cycling, right? So we can calculate his MET minutes, and you can see 15 to 20 MET minutes a week. Not really enough when our Surgeon General says we should have 500 to 1,000 MET minutes a week of activity. Over time, so Brian cycles consistently nearly every day at home, both arms and legs, and you can see this incredible increase in his energy expenditure over time. He's sort of in a maintenance phase at this point, holding steady at about 16 to 20 watts per session every time. But now look at his weekly MET minutes, 900 to almost 1,200 a week. So well and above what we as individuals need for our health. More importantly is that since his injury, he has never been rehospitalized. He has never had a pressure injury and never had a respiratory infection, right? He is remarkably healthy for someone of his injury level. And I think that is a testament to his dedication. He's going to tell us way more about it. He can speak about himself better than I can. So we'll hear from him soon. All right. So like I said, Brian was lucky to start very early, acutely in his injury, but we can still see benefits for those that aren't as fortunate to be exposed to this modality right away. People that live in more rural areas or rehab hospitals that just really haven't adopted FES well. Those patients eventually find us or find someone with FES, and they can still benefit. So if we look at just a couple of quick studies, in the first one, subjects that had complete or incomplete injuries that were more than 6 months out from their injury still showed improvements in motor scores on their FIM, their 6-minute walk test, forced vital capacity, right? So that was really important. And then in another study, they looked again at chronic SCI patients. In this case, some of them were up to 16 years from their injury. Again, did some consistent FES cycling, showed gains in their combined sensory motor scores compared to a decrease in those scores for those that didn't FES cycle. improved quad mass, muscle strength, quality of life, and daily function measures were also higher. So it's never too late to start, I think, is what we're trying to say here. And just to give another example of that, just another patient example, this is our friend Aaron. He lives in the UK. He sustained a T6 Asia A injury in 2016, but he did not get exposed to FES technology until 2024. Right. So now he does have an FES bike at home. He's been using it consistently since December of last year. What he tells us is that, he's always spent a lot of time exercising his upper body to make sure that it was fit and strong. And now with the RT300 and FES cycling, he's able to do the same thing for his legs. And just to show that he is also showing tremendous improvements. So we started at 3 kcals per hour last December, and 10 months later, he's up to almost 14 kcals per hour and 15, almost 16 watts of power, right? So again, a testament to that consistency and those improvements that we can see over time as his muscles go through a conditioning effect. Okay, switching gears, now we'll talk about another tenet of that activity-based therapy paradigm. So task-specific training now integrated with FES as well, right? So what we know from the literature is that if we take our normal PT and OT interventions and add FES to them, they're more effective than just doing the interventions by themselves, right? So both with upper extremity, so functional use, motor control, things like that. We see the same thing with lower extremity activities as well. So gait and balance benefits, muscle mass, strength, motor control as well. And for anybody interested in research, we have a whole reference summary that we'd be happy to send you if you're interested. Okay. So another really important aspect to think about when we think about even like just task-specific training is those pulmonary benefits. So the literature has shown us that abdominal FES can improve respiratory function, both in the short and long term, right? We can have an improvement in cough peak flow. And then training with abdominal FES has been found to lead to an increase in unassisted vital capacity, forced vital capacity, and our peak expiratory flow. I'm really keeping my fingers crossed right now that you can hear the sound in this video. Can you? Oh, Colleen, unmute yourself.
Go back
Let me go back
from the beginning. Brian,
all right, we're gonna go from the beginning. Like Colleen is gonna play Brian. Got it, Colleen?
You could hear it that time, actually.
Okay.
Him.
One more. Okay, now we're gonna turn the FES on and cough again. Go, Colleen. Here it goes. Go.
Actually could
It's
hear
really,
it.
I wish you could hear this. There is a definite difference. Brian's laughing at us right now. There's a definite difference between with and without the FES, and he can probably speak to that when he talks to us as well. Just a few other examples of some functional activity. So if we look at a lateral reach with this particular patient, I'll play both videos together. So we can see that there's a lot of electrodes on his back. So we are really working on stabilizing him proximally, so stabilizing the trunk and the core in order to enable that distal mobility, right? Stability before mobility. So we have the ability with these multi-channel systems like Excite to do all of that at the same time. This gentleman has probably 8 to 10 channels of stimulation on his core and just his right side, right? So we can really, as we like to say, light him up and get some really good functional movement here. This is one of my favorite videos. So we have a functional reach and retract activity. And this gentleman really wanted to work on controlling his wheelchair with a goalpost controller. So it's hooked now to the controller for an RC car. And his goal is to drive that car straight to knock over some cones, right? But a really functional way to use that activity for this person. All right, one more time, because I really like it. Okay. All right. So again, looking at posture, those core muscles, again, stability before mobility, more than just sitting edge of mat, right? So now we can also look at, can we provide some correction for, say, a scoliosis, right? In this case, it's more flexible. So we can apply those electrodes to the weaker lengthened side and try to strengthen those muscles so we can correct her posture. We also have a wedge under one of her hips to kind of help with this because her scoliosis is quite progressed now, right? But just some other uses to think about with FES with our patients, a very functional way to use this for her. All right, looking at restorative therapies devices just a little bit more. So the RT300 we saw earlier, so our FES ergometer system. This patient is lower extremity cycling, but the device can do lower or upper extremity cycling, both with core, covering all the major muscle groups in the lower and upper extremities. All right, so we'll watch him. He's going to leg cycle, and you'll see an example of him arm cycling. Right, there's a version of this system that does not have the arm ergometer for those that don't need it. So maybe our thoracic or lumbar injuries. Right, and just some features of this system. We have dedicated channels for shoulder and scapular stability. So I'll play this video. This gentleman has a 2-finger sublux. When we apply the stimulation, in this case, it's on deltoids. The other electrode is on infraspinatus. We can now relocate the humeral head back into the glenohumeral fossa so that now that shoulder is in a good position to be able to perform a repetitive activity. With FES cycling, that stimulation would stay on the entire time. It would never turn off, so that humeral head would be relocated the entire time, right? A really important feature for arm cycling. We also have software features that manage spasms as the crank is starting, as the stimulation is starting, to help prevent spasms from happening with both the movement and the FES itself, so that there's less clinician intervention needed, right? There's less. It makes it much easier for setup. We can customize those programs to the individual needs, goals, and impairments in terms of all the stimulation parameters or speed, resistance, things like that. For our home customers, we can automatically progress their speed or resistance with the software. So again, less intervention, follow-up needed from clinicians. We collect data so we can track progress over the course of their lifetime, right? So we have patients that have been cycling for 20 years, and we can see 20 years of cycling with them. There's on-screen feedback during the sessions, availability of both my team, so Colleen and I for clinical support, our technical support team. We have a dedicated reimbursement team that helps patients be able to get these devices in their home and have access to that more consistent cycling to get those great health outcomes. And then some off-device stimulation programs available for functional movements from those home systems as well. Okay, looking at task-specific training, again, just a couple more videos with our Excite system. This happens to be all lower extremity activities, but it's not nearly close to all the activities that we have. But really what I wanted to be able to show you is that whether that individual has a higher or lower level of functioning, there are lots of activity. There's something available for everyone within the Excite system. Anything from just simple single joint exercises up to weight bearing and pre-gait exercises. So there's something in there from everyone. And we basically cover like all the major activities that you might do with your patients in clinic. So again, the evidence shows adding FES to those interventions makes them more effective. So we're not adding like this new technology to what you're doing. We're just making what you're doing more effective. Okay. So 5 libraries of about 48 pre-programmed functional activities. So we've taken those activities, we've determined the muscle groups that are needed for them, when they should turn on and off to best match physiologic movement, and programmed all of that into our software. You can continue to customize all of those programs based on what your patient needs. Continue to have those dedicated channels for shoulder and scapular stability. So if we're in a more weight-bearing position, we can make sure that we're still stabilizing that shoulder. On-screen feedback. We have a therapy guide built into the software to highlight the activity ideas to help guide treatment planning for you. So we've given you lots of ideas of what to do with these activities. Again, our remote clinical and technical support, and the system is really portable, can really be used in any environment, whether you're in an ICU, outpatient therapy, or for our patients at home as well. Okay. Looking at these two systems together as like a suite of complementary products, we get mass practice from the RT300 and that ergometer-based system. We can reduce tone and spasticity before moving into more functional tasks. We get progressive resistant activities for those health outcomes, and we can prime the nervous system. And then move into our task-specific training with Excite, with these activities that facilitate more meaningful, engaging goals with our patient to help promote more independence. And we can do that really quickly by transferring from one system to the other with pulling a cable out of one and sticking the cable into the other system, right? It's really easy to set them up to be able to do that very quickly within one treatment session. All right, takeaways from today, right? You can get some long-term health benefits of FES, really, really important for our spinal cord patients, all of our patients with neurologic injuries, to be able to get that activity, to get these long-term health benefits, to improve their quality of life and functioning. So we can improve muscle bulk, which can help reduce the risk of pressure injuries. We can improve our metabolic function, reduce spasticity for greater independence and quality of life, reduce the risk of osteoporosis and bone fractures by improving our bone mineral density, right? And here's another why. We kind of touched on this a little while ago with our pressure injury talk. So we had this paradigm shift, like we're sort of in a reactive model of treatment, right? Something happens, we get treatment, but really the more sustainable way to do this is to prevent those secondary complications in the first place, to reduce our overall burden on the healthcare system, our caregiver burden, and improve quality of life. Right? We talked about how much these secondary complications cost each year. Okay. FES at home is super important. So our individuals with long-term injuries need long-term access to equipment that will maintain and help improve their health. They can maintain their gains from therapy. Like, why go to a 12-week bout of therapy, make these gains, and then do nothing for a year, and then go back and do it all over again, right? So if we can maintain gains or even improve things in between those bouts of therapy, isn't that more effective for us? Patients are less likely to be rehospitalized, and we can deliver FES efficiently and easy at home. And again, if we think back, all of those studies on those long-term benefits, we need consistent cycling over time. Okay, and this is my last slide, and then I'll let you talk to Brian because you'll like him better. So integrated FES therapies are embedded within that approach that we call activity-based therapy, right? So FES with mass practice, FES with task-specific training, okay? Combining integrated FES with those therapy interventions you're already doing, right? So this is Excite with FES, leads to enhanced outcomes of those interventions. We're not limited by age, diagnosis, or functional capacity. So don't just think about adults. Our pediatric patients need FES too, right? And based on all of those benefits that they can get, you know, I'm not going to say, oh, this person is ambulatory, they don't need FES, right? They might need FES for spasticity management. They may still be weak in some muscles. So I'm not going to exclude them just because I say they're at a higher functional capacity. And the big takeaway is that translation beyond the clinic is really, really important to get those optimal health outcomes. Okay, I'm done. I'm going to introduce Brian now, and you're going to love him. Okay, I think I'm going to introduce Brian. Okay, so this is Brian Kiefer, our good friend at RTI. Again, he had sustained a C4-5 Asia A injury from an accident in 2008. Since that time, he's graduated college, became a certified therapeutic recreation specialist, had an assistant coaching internship with the Paralympic sitting volleyball teams. He's a TV star now. He was featured on Extreme Makeover Home Edition. You can find that episode on YouTube now. It's in two separate hour-long episodes. I highly encourage you to watch it if you've not seen it already. He has a whole range of interests: reading, attending dog shows, watching volleyball, talking about comics. You can see him here: scuba diving, skydiving, all sorts of stuff. So I'm going to turn it over to Brian now. Oh, unmute yourself, Brian. I don't know if I can unmute you. Oh, can I unmute him? It's okay, Brian. There's always technical.
Okay.
There we go.
Can you hear me? Hi, everybody. Like Lori said, I'm Brian Kiefer. I'm going to tell you a little bit about myself, about my injury and RTI. I was hurt when I was just before my 21st birthday. I broke my neck in a gymnastics accident. I tried to do a triple front flip, and I only got 2.5. I landed on my head at the bottom of the pit and broke my neck. I am Asia A. Like I said, I'm C4 Asia A, so I don't have really any movement or feeling from about my shoulders down. When I got hurt in the summer between my sophomore and junior year of college, so I wanted to go back to school and complete things, but the injury obviously was a huge problem, and I took a year off from school just to try to learn how to take care of the new me and to see what I could do and how my life would change. So I was in the hospital for 17 days, where they put steel rod in my neck to stabilize it and just try to get me stable again. Then I spent 9 weeks at an inpatient facility in Philadelphia. That's where I first started doing therapy. And after my accident, I lost probably 30, 35 pounds of just everything because I wasn't doing anything. I had gone through this traumatic injury and my muscles were disappearing. Just my health was not the best because I just broke my neck. So I started learning how to take care of the new me and started getting into therapy and doing things like just trying to sit on the edge of the mat or sit up in bed even before I even got on the mat. So things were very difficult because I couldn't really move anything and I was basically just dead weight. Then I got into some more aggressive therapy. Once I was a little bit more stable, I was able to get out of bed and move around in a wheelchair and do some mat work and try to do just anything I could to get myself moving and get my muscles going again. And that's where I had my first experience with RTI, with the sim bike. They had the McGee, where I was, had a leg bike that I could get on, but they thought because of my injury level that it wouldn't really do much for me. McGee thought this, my therapist. So I wanted to try it anyway to see what I'd be able to do. And they hooked me up to it. And it was like I was biking again. It was fantastic. I got electrical sim and I got my muscles moving. And that was really the first time that I'd been introduced to it. And I loved it because it was better than me just sitting there and hopefully not falling or trying to have somebody catch me. I was actually able to do something. And again, I've always been athletic and I loved exercise, and biking was so much fun. So getting out there and like being able to bike again, that was just a huge plus in and of itself. So I was at McGee for 9 weeks, and then I was discharged and sent home. And I wanted to be able to keep doing that. Sorry, I'm going to go back a little bit. While I was at McGee, I only got to ride the bike 1 or 2 times, I think, because they didn't like putting me on it because I was such a high level and at a high risk for everything. So I didn't get as much time with it as I wanted, but I still really liked it. So when I came home, I wanted to get more therapy. I wanted to have access to a bike, and I was lucky enough to meet Adam Telefero, who he has a grant for people that are athletes and hurt in athletic injuries. And I was able to get my own bike working with him. So I think a year after I got home, I was actually able to get my own bike and start riding it. And I wanted to go back to school too. So I started back at Lock Haven and I took my bike with me and I got on it and I like to ride it, but I still had school to do and life was happening. And I didn't ride it as much as I should have. And my doctor yelled at me, my therapist yelled at me, everyone said, you need to get on there and start doing therapy. And I said, I know, I really like doing it, but some like other things are happening too. I'm at school, and I probably could have gotten on more than I did. But after I graduated school, I came home and I started doing my bike a lot more faithfully. I did it as often as I could, every day if I could. I did I did arms and legs, just about every day, and the benefits that I saw from that really, really changed my life. Like Lori mentioned earlier, I've been hurt for 17 years. I've never been hospitalized. I've never had a pressure sore. Uh, my muscles are still strong and able to support myself. I'm able to move around a lot more. I don't know if you've noticed, but I've been leaning forward a lot, moving a lot during this presentation because I have trouble sitting still. I've never been able to sit still. And I think that the therapy from my bike has really helped with that too. It's made my muscles strong enough that I can move a lot more. As a C4-5 Asia A, I'm not supposed to be able to do a lot of the things that I can. I'm not supposed to be able to sit on the edge of the mat and hold myself up. I actually drive my chair with a joystick with my arm. I'm not supposed to be able to do that at my level. And I think a lot of it is because of the therapy and the bike over the years, because of how strong it has gotten me, how it's conditioned me to keep me healthy. When I do see new therapists, they look at me and they are confused about what I can do because they see my level on the paper and they're like, oh, I have these expectations. And then they see me and I'm not what they see on paper. And again, I attribute a lot of that to RTI and to the bike that I ride. So I try to ride it every day, upper and lower extremities, and I've ridden, I think, over the circumference of the earth because of how much time I put into it. And I love doing it. I love demonstrating for people, and I try to talk to people about it when I hear about new injuries or when I go to therapy. Like when I go to a place for therapy, I talk to other patients and explain to them what the bike's done for me and how it's helped me. And I just tell them my experiences, and it really shows them that the bike helps, RTI helps, the stim really helps. I talked to a patient recently who is being hospitalized every month for different problems, and that it blew my mind because I've never been in the hospital. And I said, hey, do you ride the bike? Do you do therapies? And they didn't. So it just goes to show what the bike can do. I also like to travel around and I do motivational speaking to schools, colleges, nursing homes, pretty much anybody that will hear me speak and just share my experiences. I've been able to have a lot of fantastic experiences because I'm healthy enough to do them. I got to go indoor skydiving. I want to go outdoor skydiving. I think that would be amazing. I would drive my chair out of a plane right now if I could. But I've got to go scuba diving, and I coached the Paralympic volleyball in Oklahoma. I've had a lot of experiences because I'm healthy enough to do it. And I owe that to the therapy that I've done and to RTI really helping out and making a big difference in my life. And it's not only the bike that helps. I love my bike and I ride it every day, but the Excite also is very helpful for me just for functional tasks. The video that we tried to listen to earlier with me coughing, I have a very, very weak cough. If you can listen, I'll try to cough for you right now. I don't know if you could hear that. I could barely hear it, and I was the one that coughed. When I used the Excite program, they put the stim on, and I was able to cough right at a certain point, and it really, really helped. And the first time I did it, I coughed something up, and I said, "Oh my gosh, I actually just coughed something up," and said, "Yeah, that's the point of it." It blew my mind that happened. So it was another really good experience, and just knowing that RTI and STIM, just Excite, has a way of helping people with functional problems. If I had something stuck in my throat and I was coughing and choking, I could use that to really help to be able to breathe again. Like, you got to be able to breathe, obviously. So it's really nice having those things that work and showing that it's actually able to work. So I can't speak enough good about RTI and how much it's helped me and just keeping me healthy, keeping me active. Because no one just wants to sit still for the rest of your life. You want to go out and do things, and you got to be healthy enough to do that. Your body has to be able to support you, and you need to take care of yourself. And RTI really helps with that. The bike helps with that. STIM helps with that. So I'm able to go out and experience things. I'm not just stuck in my chair. I'm not stuck at home. I'm able to go out into the community and experience life because of the good health that therapy has given me, that RTI has given me, from just electrical stim. A lot of patients don't like stim. I don't have feeling where they put stim, so I can just crank it up and I say, give me all the stim you can, and I love it. To a certain degree, we're not trying to burn me or anything, just get good therapy from it. But I love stim. I tell people that all the time, and it's good for me.
Thanks,
Lord,
Brian. And I'm going to say, even just, thinking about his injury level and, the innervation of the diaphragm, think about how well he's speaking to you and how much he's talking to you without taking a breath. Right. He does abdominal stimulation with his therapy almost every day. So he's had a lot of abdominal FES training, which we talked about earlier in terms of some of those functional improvements as well. Are there any questions for Brian? Questions for Restorative Therapies? Let's turn to the next slide.
No questions have popped up in the chat, but just to point out, April had put in the chat for you guys if you wanted to see the link for the full video of the cough program, in addition to a few of the other expansion pack programs that we have. So if you look in the chat box, you can have access to that link. And I do have one question for Brian. Just in talking about, since you're doing cycling so much and doing it at home every day, how do you feel setup time takes? Because that's something that we get a lot from therapists and patients as to how am I going to fit this in. So what is your thoughts or 2 cents on that?
Because it can definitely take some time. There's a lot of stim that goes on, a lot of padding. You got to get the pads everywhere. You got to make sure everything's working right and the stim is set to the correct levels. So it does take a little bit of time, but we've been doing it. My dad is my main caretaker and therapist and helps me out with that, and we've been doing it for so many years. It takes us a little bit over 10 minutes to get full setup, from not having everything out, just like nothing, to full setup and me actively riding. A little bit over 10 minutes.
Great.
I was going to ask a question back to you, Brian, and perhaps the RTI folks. When it comes to home use, that question was very, very relevant in that. How do you communicate what Brian just said? Because when you hear 10 minutes, that's not a lot of setup time for home use. And I was wondering about how it is you educate the consumer that is looking at purchasing the units or bringing them home, and how you walk them through Brian's experience potentially and those of others. Is there a training session that you put together? Is it in person? Is it online? Those are questions I was just curious as to ask.
Take it.
Yeah, good questions, Barry. Yeah, I'll
Yeah.
take that one. So when someone purchases a home device from us, we have an installer go to their home. It's a trained PT or OT who uses our devices in clinics and has been trained by us. So it depends. It can be a 3 to 4 hour install in the home. If you're doing arms and legs, it's a longer period of time. So we set up the device and we spend as much time as needed training any of the caregivers that are there and the patient. They normally have had some education from using the device in clinic. So this is, just kind of a refresher and having them learn how to do it all on their own without their therapist there being the ones to do it. So we talk them through that. And then they have access to our clinical education team that Lori and I are on. So we can do remote support sessions with them. They just schedule an appointment with us online. We can remote into their tablet, be on a Zoom or FaceTime with them. So it's kind of like we're there in their living room and able to help talk through them any physical setup or any stimulation changes that need to be made. So it's a great model that we have for that ongoing continued home user support.
And I would assume this obviously the same system be in place for when you're supplying the units to clinics, of course.
Yes. Yeah, we have dedicated clinical representatives in different territories throughout the US. So they do, usually it's a 2-day install training for the RT300 and a 1.5 day for the Excite. And then our reps always schedule, follow-up visits, within a short period of time after that install, and then are always available for in-person co-treats, and as well as they can do remote sessions as needed. So that's a lifelong benefit. You have all the clinical and technical support from from our company.
Great, great presentation. Just wondering if anybody else has any other questions, please feel free to put them in the chat. You did make mention earlier on, we saw a listing of some of the research that you've been involved with. Is there on your website the potential of looking at all of the research studies you have been and published work?
So there are some studies on our website, but we can also send you there's too many to put on the website. So we can add, and some of them are with the 300, some of them, came before the 300, or Excite. So we can send you the whole list, which is probably hundreds of studies at this point as well. But yes, some are on the website. We can send you a full list if you're interested.
Great. I see we have a question in the chat from Patricia, asking, in order of magnitude, what's the ballpark price of the equipment?
Yep, that's a good question. And there's kind of a range that can be required depending on what it is you're getting. If it's a 6-channel system, is it a 12-channel system? Does it include arms and legs? Is it someone who needs adjustable arm cranks, like with Brian's level of injury, to have a little bit more support and flexibility for the right setup with that? I'm waiting for an answer if one on our sales team can give a more a more detailed breakdown of the cost, because Lori and I spend a lot of our times with the patients and the research, so I don't have full visibility on that. So might just hold a minute or
Maybe
two
for
if we can.
Gabriella.
Hi, hi, Colleen. Hi, Lori.
Oh, hi, Stash.
I'm happy to jump into the discussion. Hi, everybody. My name is Stash Kachelis. I'm the Director of Sales here at RTI, and thank you all for attending this session. And this is a tremendous question, and obviously one that we receive all the time. So simply put, as Colleen was detailing, there are a variety of configurations. And for home, that the base configuration can start around $24,000. Into the more complex configurations, that will be for upper and lower and 12 channels of stimulation. You're looking at around $41,000 for the system. However, I do want to remind everybody that this system isn't just something that's that you can access. This is easily. This is a Class 2 medical device. It's German engineered, manufactured, and although the life expectancy of the system is officially 10 years, we have systems that are out in the field being utilized by individuals for 15, 16, 18 years, right? So, I mean, like, look at this. If you are serious about investing in yourself, in your health, in your well-being, that yes, it can seem like it's a lot, but if you average that out over a year, it's an incredibly accessible amount for your well-being, for your health, and for you staying in a position for you to continue onward doing the things that you want to do, which is being involved with your friends, your family, your career, and any other pursuits that you want to have for yourself in life.
My understanding too is there is a lot of potential funding up there, for example, through the VA, and of course, private insurance and other means. Did you want to expand on that a little bit?
Yeah, I would love to. And I know in her presentation, Lori did share that we do have a pretty robust reimbursement team here. So we have 4 dedicated individuals who are just working right now with private providers. So we are constantly trying to negotiate rates with them in order to provide this therapy and their availability at home. If you do happen to have VA benefits, then that's a tremendous boon for you, because we have a program with the VA which allows you to trial the system in your home for 3 to 4 months. And if you are compliant, the VA will then go ahead and provide you with that system upon completion of your trial period. So again, if this is something that you have, by all means, we would welcome the conversation with you, and we can direct you to your closest VA or put you in contact with somebody who can get you your evaluation and then your trial process started. If you have been injured at work, we do have a workers' compensation partner as well that we can work through. And of course, we have an abundance of relationships with also private funding foundations. So we work with national groups, regional groups, even small, church and town groups. So we work the gamut with everyone. So the best thing you can do if you have interest in this is don't just think about the price. Give us a call. Let me or one of the team speak with you. We'll provide you an array of options as to what you can do, and then you work with yourself and with your family and you find what's going to work best for you.
It's great stuff. Final words, Lori or Colleen?
I think we just want to say thank you all for coming. We really enjoy doing this, spreading the love of FES. Colleen and I have both worked a long time with FES devices. We love it just as much as Brian, if not more. Thank you, Brian, for coming on. We love having you with us.
Thank you. And thank you for joining us today. And I can concur, Brian. I know what it's like. It's a great feeling to feel those legs and getting that circulation going. And maybe that's something that can't really necessarily be measured, but it's something that we know internally. I just wanted to mention again that this is a great opportunity for people to learn more about the program and what our RTI offers. Please visit their website. And if you want more information as well, come to ours. We do have to express that these the views and comments made today do not necessarily represent those of the North American SCI Consortium, but that of Restorative Therapies. That said, I can say personally that I am a user of the product and enjoyed the sort of the fruits and benefits of it during the time that I did use it, and I can say that with all sincerity. So, on behalf of all of us, we'd like to thank you all for joining us today. And again, for more information, you will get also a replay of this piece sent back to you if you want. And please feel free to share this with all your friends. I think it's important that more people get an opportunity to learn more about this great product and what RTI and what RTI offers. So thank you again for coming on today and being part of this piece and being a great partner with the North American SCI Consortium.
Thank you for having us, Barry. We really appreciate it.
Goodbye, everybody.
All right. Bye.